One of the most searched questions in gut health is this: what is the best probiotic to take with antibiotics? And one of the strongest evidence-based answers is often Saccharomyces boulardii. Antibiotics can be life-saving, but they can also disrupt the balance of the gut microbiome. When that happens, some people develop antibiotic-associated diarrhea, meaning loose stools, digestive upset, and changes in bowel habits during or after antibiotic treatment. Several meta-analyses have found that Saccharomyces boulardii can reduce the risk of antibiotic-associated diarrhea in both children and adults. That is why it remains one of the most talked about options in probiotic research. Why might it help? First, because it is a yeast, it is not targeted by standard antibacterial antibiotics the same way bacterial probiotics are. Second, it appears to help maintain barrier function in the gut and may reduce some of the inflammatory disruption that antibiotics can trigger. It may also compete indirectly against unwanted organisms and help support a healthier intestinal environment while the microbiome is under pressure. This does not mean it completely protects the gut from antibiotics, but it may lower the chance of diarrhea in the right setting. That said, it is important to keep expectations realistic. Saccharomyces boulardii does not make antibiotics harmless. It does not guarantee you will avoid diarrhea. It does not replace hydration, nutrition, or medical follow-up if symptoms are severe. And it is not a reason to ignore red flags like fever, severe abdominal pain, blood in the stool, or persistent diarrhea after antibiotics. Those are situations where you need medical evaluation because simple antibiotic-associated diarrhea and something more serious, like C. diff, can look similar at first. So the practical takeaway is this: if you are looking for a probiotic for antibiotics, Saccharomyces boulardii is one of the most evidence-backed options for reducing antibiotic-associated diarrhea risk, especially when the product matches the studied strain and the person using it is otherwise an appropriate candidate. But it is still not for everyone. Critically ill patients, people with severe immune compromise, and people with central venous catheters need special caution because rare but serious fungal bloodstream infections have been reported in those settings. Healthy adult does not always mean hospitalized patient. That safety distinction really matters. Click on the description to watch the full video. Subscribe to this channel because we turn complex scientific topics into simple and powerful information that you can actually use. And if you found this helpful, share it with someone who cares about their health.